Now, for more on this story, I'd like to welcome Noopur Tiwari to the programme. She's an independent journalist whose coverage focuses on India. She joins us via Skype from here in Paris. Thank you so much for being with us this evening. We just heard in that report a 3-week lockdown for 1.3 billion people. Some observers even saying that India's been more proactive in fighting coronavirus than the US.
Actually, there is a lot of distortion in what we are actually being able to see in India, because in your report, you mentioned that India has crossed the number of infected cases beyond 500. But the fact of the matter is that the number of deaths that are being reported, the number of cases that are being detected, there is a kind of chaos and blur also regarding these numbers. So that is one of the most worrying things. Do we really have good data right now that is being conveyed to us? And there are a few other things that are extremely worrying. One is that India is a country of a huge number of people, 1.3 billion, and the health infrastructure that we have is very, very fragile. For example, there is about half a bed for every 1,000 people in India. There are some areas in which there is one doctor per 2,000 people. And there have been also reports and some data emerging that this number is actually much bigger, the number of people that one doctor will have to be in charge for. So please remember that India spends only 1% of their GDP on the health sector, and a huge number of the beds, about 40% of hospital beds, are with the private sector, which actually controls about more than 70%.
Noopur Tiwari, I'm going to interrupt you there. We have a short segment with you, so I want to get through as much as we can. You just mentioned inaccurate data, lack of transparency. Would you say that this is particularly exclusive to India, or this is something that we are seeing in a plethora of countries across the globe as we're trying to tackle the coronavirus crisis?
I think there are two things. One is that, yes, there might be a certain level of lack of transparency, but I think everybody has been blindsided practically everywhere. So the numbers that we are seeing, we are not able to actually detect the transparency of these numbers and what method is being used. Because really, it really is like everybody has been taken by surprise, except that in India, what happens is that the number of people that we have there is obviously massive. So this is going to be affecting a lot of poor people. The unorganized sector is huge. There are people who are rushing to the police stations to figure out how to go back home. There are people who are not getting food, so they're going to shelters to get food. And there are thousands of people in Delhi who are collecting in centers, increasing the chances of the infection actually spreading. So the situation right now, as of today, is actually very, very, very critical. And
so
maybe
critical
in the next 2 days we'll get to know.
As you just mentioned, we're talking about nearly a fifth of the world's population. I want to talk about more grassroots movements, if we can, something that you may be familiar with. You know, there are a colourful array of campaigns circulating across the country as we speak. People sometimes making outgoing phone calls. They're made to listen to a recorded message about hand washing. There are videos of policemen doing the hand washing dance. Do you think things like this are in any way effective?
No, I really feel that all of this is happening. So you do have a certain class of people who, a certain privileged class of people who are able to access this information. But there's a huge number of people actually who do not have shelter, who do not have food. There is actually a real danger of people dying of hunger in India right now. So the proportion of the crisis is actually massive. Of course, there is a certain number of people, middle-class people, who do have access to all the information, and it is being filtered in pretty much in a similar way as we saw it in Europe. So I was in Spain when these measures were starting to be installed in Madrid, for example, where schools were being shut down, etc. And then I came here in Paris and I saw that there were some of these, the psychosis, the fear, the shock, the realization, and then the putting of the measures in place has actually followed a very similar pattern. So that's happening in India too, but with an added layer of chaos, where the Prime Minister actually makes a long national address where he tells people to come out on the balconies and hit utensils and clap. In France, when we do it, it's actually something really spontaneous to support the hospital staff. But in India, it was chaotic and really pretty ridiculous. And a lot of people were very shocked by this also, because the ruling BJP is still focusing on things like what you saw in your own report, where there are politico-religious ceremonies being held where people are coming together, and there is this level of incompetence from the government, and also we can very easily sense that they don't really know what to do right now. So not only will this lockdown of so many people, all of a sudden the economy coming to a grinding halt, not only will this not do much to help the virus from spreading, because a lot of the work that needs to be done is not being done. It will also very, very adversely affect India's economy.
Noopur Tiwari, I'm going to have to stop you. Thank you so much for that very interesting insight into the health, the social, the economic impact, the worrying impact of COVID-19 in India. Thank you for being with us.